16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Radiology is a science of telling a story through images. Good evening and welcome, dear friends. This is Meenakshi Sharma back again with yet another new episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. Dear viewers, radiology is a branch of medicine that uses imaging technology to diagnose and treat the diseases. It can be divided into two different areas. Number one, diagnostic radiology, and number two, interventional radiology. Radiology helps us to look inside the body without opening it up, and it is a bridge between the clinical and the surgical. To throw more light on today's topic of discussion, that is radiology, we have with us Dr. Hafsa Qayyum. She is a specialist radiologist working in Al Hilal Hospital, Moharrak branch. She has done her FCPS in diagnostic radiology from Aga Khan Hospital, Karachi, which is one of the famous hospitals in Pakistan. And also she has worked as an assistant professor radiology for 3 years in Baluchistan Institute of Nephrology and Urology, Quetta. So let's welcome her.
Hello.
Good evening, Dr. Hafsa,
Good
and
evening.
welcome to the show.
Thank you for having me on the show.
Thank you so much, Doctor. Doctor, to begin with, as you know, today's topic of discussion is radiology. But before that, we would like to know why did you choose this career, radiology, as your career option?
Okay, so I chose radiology because radiologists are said to be doctors of doctors. Fine. So basically, what we do is being a radiologist, I guide other clinicians, other physicians to where they are stuck in certain place for the diagnosis of the patient. We guide them that look, this is the diagnosis. Like in your introduction, you said that in radiology we do a diagnosis without opening up the body. Fine. So the same thing like fascinated me that being in a black and white world, still we can see everything inside the body and we can diagnose the patients. Fine. Like any clinician has no clue about there is pain in the abdomen, and they have, like, for example, there's no clue about what is the pain all about. So being a radiologist, I tell them that look, this is pancreatitis, or see, this is appendicitis. So by my diagnosis, the surgeon open up the body. Like for appendicitis, they operate for this appendix and all. So this thing really fascinated me. That's why I chose radiology as a field.
That's so nice. Like instead of choosing other career options, like this fascinated you more.
Yeah, because
you,
it is also a very vast subject. Na? In radiology, you're not limited to any certain area of the body. Like in gynae obs, they're just limited to gynae obs. In radiology, we also do neurology. We can also do breast imaging, we do pediatrics, we do musculoskeletal, we do every kind of things. Na? So this was also a reason, like it's very vast. We should know everything from tip to toe. Any pathology, it should be on our tips. So it's a vast thing, and it's general, like we can go into any field. So that's why it was good.
So, doctor, now coming to our topic of discussion, which is radiology. So, we would like to know what exactly is radiology?
Radiology is basically a field of medicine in which we do the diagnosis. Fine. We help the clinician to get to a certain diagnosis. For example, there is a certain, for example, a patient is coming with brain headache, okay, is coming with a headache, and the clinician orders a CT scan. So we do a CT scan and we tell the physician that see, there is this mass in the brain which is causing the headache, and then the neurologist would decide whether we have to go for a surgery or not, and all this. Na? So basically radiology is looking into a person's body, inside the body, without opening it up. See, so in radiology we have many different modalities like ultrasound, X-ray, which was an older modality, then came the ultrasound, and CT, MR, mammogram. There are certain fields which helps a patient with the diagnosis. So radiology is a beautiful field of medicine where it's not beautiful for us, it's just grey and shades of grey, but for people it's good, it's helping out the physicians to get to certain diagnosis.
Now, since you have told about radiology, and in the beginning I spoke about that there are two different areas of radiology, one is diagnostic and the other one is interventional. So what is the difference between both of them?
Okay, so diagnostic imaging is we just deal with the diagnosis. Like we give a diagnosis, like for example, we said that this is pancreatitis, fine. We just gave a diagnosis, and then it's the primary physician's job to decide what to further do the treatment. Diagnostic radiology, we mean that it's just about giving a diagnosis. But in intervention radiology, as the name suggests, that there is intervention in it, fine. So I'll just give a small example to better understand it. Like in intervention radiology, for example, we have an aneurysm in the brain. Okay, so in intervention radiology, what we do is we go through an artery in the leg, like femoral artery. We go through a catheter and we go all the way to the brain, and over there we put a coil for the aneurysm. We do the coiling and then we come back again without any surgery, without anything. So it's minimally invasive and the patient is good to go after a few hours to home, fine. So it's minimally invasive and it's a very good and a new field in the field of radiology with a very wide scope, and it's very fascinating. See, we don't open up the body. In a brain aneurysm, if it's in brain, we have to open up the brain and then go and do the coiling. It's not like this. It's just like a catheter you put inside the vein. It's the same catheter, a bigger bore. We get inside and we do the coiling and we come out. It's nothing invasive done. So this is the beauty of intervention radiology.
Okay, doctor, now since you have told us about the difference between diagnostic and the interventional radiology, so we would like to know more about the modalities you have in radiology.
Yeah, so there are like different modalities in radiology. First to begin with was X-ray. Like when radiology was born, it was just X-rays. Then ultrasound came, then CT, MRI, there is also mammogram. PET CT is also a field of modality of radiology, and nuclear imaging. So there are a lot of fields in it's like radiology is vast. You can use any modality to diagnose a specific thing. Okay, so it depends upon the clinician that which modality do they refer us to. Like if a clinician feels like CT is better for this particular patient, so we just directly go to a CT. For example, if he thinks that no, first ultrasound should be done, then he sends the patient for the ultrasound. Then on ultrasound basis, we suggest that an MRI should be done or a CT should be done. Fine, you got it now. For example, there is on ultrasound we find that there is a mass in the pelvis of a female. Fine, so we write it down that there is a mass, and further evaluation with MRI is suggested. So then the clinician would ask us for an MRI. And then we will characterize the lesion according to the MRI and give a specific diagnosis. Okay, so these are the different fields of radiology.
Okay, doctor, now you have told us about radiology, the different areas of radiology and modalities of radiology, which includes X-ray, CT scan, PET scan and mammogram. So, when it comes to mammogram, we would like to know what is the importance of mammogram.
Yeah, so basically mammogram is very important screening tool for diagnosing early breast cancer. So basically, like we can pick up a very minute lesion on the mammogram, if as small as size of a rice grain, earlier. Okay, so even before a patient can feel it herself or the breast surgeon can feel it, so we can pick it up on the mammogram. And picking up an early lesion on mammogram means better chances of survival. Fine, so basically I would recommend every female at the age of 40 or above the age of 40 to get their yearly screening mammogram done in order to get earlier diagnosis, to be on the safe side. Fine, so it's like it's recommended in NHS as well that yearly mammogram should be performed for early detection of breast cancer, especially those who have positive family history. So I would like to say that in Hilal hospital we are giving the services of mammogram on very affordable prices, and we have a special package on Fridays for mammogram with a free breast surgeon consultation location as well. So I would suggest every female at the above the 40 years of age to please come and do their screening mammograms done.
Okay, Dr. Hafsa, you have shared some very important information about mammogram that needs to be implemented well on time to avoid any complications. But here it is a time for a very short break, and dear viewers, we'll be right back. Stay tuned. Welcome once again, and we have Dr. Hafsa Qayyum with us sharing some important information about radiology and its modalities. So Dr. Hafsa, moving forward, we would like to know more about MRI, which is one of the modality of radiology.
Yeah, so MRI, like the name suggests, it's magnetic resonance imaging. It uses magnetic field to create an image of the human body and to diagnose specific things. It is having another beauty, like it can get to it has a very good soft tissue contrast in it, and it is a modality where there is no radiation exposure in it. Fine. So because of this edge, it can be used in pediatric population, in pregnant females where the radiation is prohibited. So, this is about MRI.
So Dr. Hafsa, you have told us about one of the modalities, that is MRI. So let us know more about the advantages of MRI as well as the disadvantages. First, we'll go with advantages.
Okay, so advantages of MRI is that the first one that I already explained is that there is no radiation exposure in it, right? So due to this, it can be used in all the pediatric population, in the pregnant females. Even if there is some question about the fetus heart or any other abnormality within the fetus, we can go with MRI and there is no radiation exposure. So this is the beauty of MRI, fine. And then the second advantage is that it has better characterization, means we can characterize a lesion better with MRI. That is it blood, is it fat, is it like fluid, is it soft tissue? So it's beautifully delineates a lesion. And the other important advantage of MRI is that it can pick up a very early infarction. Infarction is basically stroke for a layman language, fine. So picking up a very early infarction means it is salvageable. We can save that part of the brain with early medication. Then another advantage is that MRI can be done in all MSK imaging. We prefer MRI. Like if there is a small tear in the meniscus of the knee, we can pick it up, and then the orthopedic surgeon can intervene with the arthroscopic repair of the meniscus and all. So in the sports injuries, MRI has an edge over CT. Basically CT, we use it for like fractures and all. But in MRI, we go for, like, if we have a question for meniscus or tears or ligament tears or tendon tears, so we go for an MRI. So this is the advantage of MRI. And then another advantage of MRI is that the contrast agent used in MRI is less likely to cause an allergic reaction, whereas as compared to the CT scan contrast, that is iodinated contrast material, it has more chances of getting a reaction done. Okay, so these are a few advantages of MRI. So I guess
And about the disadvantages?
Yeah, the disadvantages are like, one disadvantage is that we cannot perform MRI on the patients having metallic prosthesis inside the body. So any person having any metallic things inside the body, it cannot undergo an MRI. The other disadvantage is that MRI is expensive as compared to CT scan. Then MRI it takes a long time to perform, like as compared to CT. With CT, it takes 2 to 3 minutes, whereas in MRI, we take like 45 to 60 minutes to perform an MRI. So because of this longer time, there are few patients who are claustrophobic, right? And due to this longer time, it's difficult for these kind of patients to perform an MRI on. Also the patients who are very serious, who cannot lay still in MRI, we cannot perform because when there is some movement in MRI, so the images get blurred. That's why a patient who cannot lay still, we cannot perform MRI on them. But we have an alternate way, like we sedate them or we give them anesthesia, and then we can perform an MRI on them if it's very important to be performed. Fine. Like on babies, even they cannot lie still, right? So for them, we have to like sedate them and do the MRI, brain or whatever. Like and another disadvantage is like MRI. Did I tell MRI is expensive, right? Yes. MRI is expensive as compared to the CT. So I guess these are the only disadvantages we have.
So Dr. Hafsa, as you told about MRI, that the patients, those who are having some kind of metallic thing inside their body, so you cannot do MRI on them. So is there any other option for them other than MRI?
Yes, then we go for a CT scan, because CT scan, there is no prohibition for any metallic object and all. Yes, it will not give the same soft tissue contrast as compared to MRI, but we don't have any other choice, right? So we go for a CT scan then. And regarding MRI, I want to mention something else, that in Hilal Hospital, we have 1.5 Tesla MRI machine with a very good resolution, and we are providing this MRI service on a very cheaper price as compared to any other hospital in Bahrain. So that's it.
That's good, like that Hilal is providing this facility for the people like of Bahrain.
Yeah, it's on comparatively, it's on a cheaper price. So because as I told you, MRI is quite expensive, and giving such a packages are good for, like, they're pocket friendly, right?
Correct. And this will be like helpful for the like population also.
Yes.
Correct. And now, doctor, we would like to know the importance of ultrasound, which is one of the modality of radiology.
Yeah, ultrasound is like the first modality of choice for any clinician, any patient who comes to a clinician. The first modality to be performed on the patient is ultrasound. Like if the patient is having pain in the abdomen, in the right iliac fossa, and the clinician wants us to rule out acute appendicitis. We do an ultrasound and we say yes, there is an acute appendicitis or not. Then they go for a CT scan and it's confirmed on the CT scan that yes, it's acute appendicitis. Then only the surgeon will intervene. Fine. So like ultrasound is the first modality to diagnose any certain thing. It's easily available. There is no radiation exposure in it. It's not expensive. So these are quite a few edges that an ultrasound has. If like for example, any pregnant female can undergo serial ultrasounds in her pregnancy for the fetal well-being, and without I mean, she's not scared of that she's having a radiation exposure or there is any harm to her baby. So she can, because it uses sound waves to create images, fine. So ultrasound has this edge that there is no radiation exposure in it. So ultrasound is a very important first modality of choice for any clinician to get with the easy diagnosis, right? See, for a CT scan and MRI, they have to like wait and they have to give contrast and it's expensive. So getting towards the expensive choice, first you go to the cheaper choice. Many of the times ultrasound becomes normal, right? You don't need to go to CT scan and MRI thing. Na? So by going to ultrasound, you rule out anything. If there is something, then we go to CT and MR. So basically ultrasound is very important.
Thank you so much, Dr. Hafsa. You have shared some important details about radiology and its modalities, whether it is mammogram, whether it is ultrasound or MRI. So before we conclude our today's episode, what would you like to share, like advice or tips from your side to our viewers?
Okay, so the most important advice that I would give is to the females who are 40 or above the age of 40 should undergo screening mammograms. Especially those who are having positive family history, and the patients who, and I'll tell the females to get self-examination done, and God forbid if they feel something, then they should urgently go to their breast surgeons and get their mammogram and ultrasound done, because getting an early diagnosis is getting in more chances of survival. So it's a very important thing to do. And the other advice I would suggest is that every patient should first don't directly come to radiology. First you should go to your primary clinician, get yourself examined, then only the doctor can recommend you to either you need an ultrasound or a CT scan or an MRI or a mammogram. There are some people who directly jump and come up to us like we need to do an ultrasound. It's not like this, right? You should, because the clinicians decide whether there is a need of getting an ultrasound done or a CT scan done or an MRI done. So don't be a Google doctor. Let us be doctors and let us decide that what is good for you and what should you undergo. So that's it, I guess.
So nice of you, like you have shared such a wonderful advice for our viewers, and I hope this will help them in some or the other way. And thank you so much, Dr. Hafsa, for coming on this show and sharing some valuable information on the topic, on today's topic, that was radiology.
Thank you so much. Thank you for having me here.
Thank you so much.
Thank you.
Think positive, eat good, and exercise every day. These are the tips for a healthy lifestyle. On this note, this is Meenakshi Sharma signing off for this evening. Until we meet next week, same day, same time. Take very good care of yourselves and your loved ones. Stay safe, stay happy, stay healthy. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.